What is not an opinion is that Black women and women in general are dying at alarming rates. How will you, what will you do to impact that?
I think a lot of the problems that we have today stem from the sexist view that women are really just baby incubators and not.
Correct.
My daughter, who is 25 years old, both my daughters actually, they have a code word with my mother and let them know that they need specific health care. And I think it's a shame that we have to use coded language in order to get real health care in this country. In order to live in this place to make it better, they have to prepare themselves for every eventuality. And I want to make sure that we're utilizing everything we have to make it better for every woman in this country.
Because OB-GYNs are leaving Texas in groves. And it's difficult, especially VA system, for women to even see an OB-GYN. So it's impacting our veterans, it's impacting our communities, and it's of course impacting families as well. So it does, just because it's a woman issue, it impacts fathers, sons, everybody.
Because doctors are saying we don't know if we're going to get arrested for assisting in healthcare or not, and that's always been a concern for everybody. But the state of Texas didn't do anything about it literally until this week, and it's been 5 to 7 years that they've had these rules that these doctors are basically being hands off and not helping out women because they're afraid of their own livelihood.
And they were like, we had to let both the mother and the child pass away. The father's there not knowing what to do, and they got 3-4 kids at home.
Yes.
So these are, it's past policy. This is people.
It is people. Every I tell people, I say this all the time. Every policy that's written, every paragraph, every page, every paragraph, every sentence, every word, a human being is at the end of that. We have to remember that every time something's written, human beings' lives are affected. And when they're taught in order to do no harm and taught to save lives, the legislature gets in the middle of that and says, hold on, we may arrest you. And that should never be something that is a burden that a doctor has to, worry about. Why are we adding more stress and worry to the medical system by these archaic laws?